My name is Gina. I'm a perinatal fitness trainer and birth doula and mom of 4, and I've had 2 pregnancy losses between my first and second child. So not only do I have professional experience supporting other women during this phase of life, but I also have personal experience of navigating fitness after pregnancy loss, and then also navigating fitness in a pregnancy after loss. And so in this video, I'm going to share my tips of navigating fitness after you've had a loss, in addition to how can you approach fitness in a subsequent pregnancy when things may feel a little bit more scary. So the first question that we commonly get is, what should I do fitness-wise after I've had a pregnancy loss? Now, most miscarriages are going to happen in the first trimester, and 1 out of 4 of us will have a pregnancy loss, which is really sad. But understand that there's really nothing that you did to cause a miscarriage, and there's also probably nothing that you could have done to prevent it. But exercising does not cause miscarriage, and there's lots of research that supports this. But 1 out of 4 of us will probably suffer from a miscarriage. If you're in your first trimester and you have a pregnancy loss, generally, as soon as your bleeding stops and you feel emotionally ready, you can typically resume your normal workouts. There's no real progression that needs to happen in regards to a rehab or a return to fitness. So you don't necessarily have to join a postpartum fitness program or a postpartum recovery program. But you will want to be mindful of how you emotionally are feeling. And so if you're finding that exercising feels good for you and it's helping you with your mental health, I would definitely recommend just resuming whatever felt good for you before you had your loss. However, if you're in your second or third trimester, it could be beneficial to have a different approach to your return to fitness. We don't necessarily just want to jump into what we were doing pre-pregnancy or even during our pregnancy. We may want to join more of a postpartum recovery program or something that's a little bit more intentional and slow in progression. The reason being is you've been pregnant a little bit longer. There's a lot more changes that were happening within your body. In addition, your birth probably is going to require more recovery in the second and third trimester. In addition to your return to fitness, it can also be incredibly beneficial to work with a mental health specialist as well to help you with that emotional healing after birth also. For me personally, after my first miscarriage, I was around 11 weeks pregnant, and so this one had a little bit more bleeding compared to my next miscarriage. With this one, I kind of waited for my bleeding to stop, and then I just kind of slowly returned to lifting and to exercise, kind of making it back to a pre-pregnancy level a little bit quicker than I would have if I had my 40-week pregnancy. But with this one, I just felt emotionally exhausted. And so I just really took my time returning to fitness because I just didn't feel mentally capable of returning to heavy lifting and running and all of those things again. And so while I physically felt capable to do so, mentally and emotionally, I was not there. After my second miscarriage, this one happened pretty early in the pregnancy. I was only about 5 weeks pregnant, and so it was almost like I was having a period and just being really sad about it. And so with this return to fitness, I just kind of resumed the exercise that I had been doing because there wasn't a whole lot of changes that had happened within my body. I barely had time to process that I was pregnant, and so for me, mentally, it felt much more accessible to just kind of return to fitness. It's really common to feel after a pregnancy loss that the magic and kind of the joy of subsequent pregnancies is kind of taken away because you know the bad things that can happen. And so just being aware of how you're mentally and emotionally feeling can be incredibly beneficial as you navigate a pregnancy after loss. And so remember that exercise does not cause miscarriage, even in the first trimester. So if you feel comfortable enough to exercise in your first trimester, it's usually totally fine to do. Now, if you feel super exhausted, really nauseous, and just overly fatigued, then taking a break from workouts is also totally fine. But you don't need to pause your workouts out of fear of losing your pregnancy. We get a lot of folks that'll say, hey, I'm going to start your workout program when I'm in my second trimester when things are all safe, but it's okay to exercise in the first trimester. But when it comes to navigating pregnancy after loss, it can be really scary. And so having clear communication with your provider on different things that you can do to help ensure that the pregnancy is progressing really well can also be super helpful for you mentally and emotionally. So for me personally, my provider did weekly ultrasounds for me. We did lots of blood tests within the first trimester to make sure my HCG levels were increasing. And so these are just some things that help me feel more confident about my pregnancy that could be beneficial for you as well. Miscarriage can be really common. 1 out of 4 of us will suffer from a pregnancy loss. And so knowing that you're not alone in this experience and that nothing you did caused your miscarriage If you feel comfortable exercising after your loss, feel free. Usually in the first trimester, you can resume normal fitness and exercise, but paying attention to how you feel emotionally can be really helpful as well. In the second and third trimester, it may be beneficial to resume fitness with more of a recovery aspect, so focusing on rebuilding, because not only did you go through pregnancy, but you also went through probably a more intense birth experience that requires a little bit more recovery. Approaching fitness in a pregnancy after loss can be really scary, but you can feel confident in knowing that exercise does not cause miscarriage. If anything, it can be incredibly beneficial. But managing how you feel physically and mentally and emotionally can be incredibly beneficial. And so I highly recommend working with a therapist or a mental health specialist to help you navigate this emotionally as well. And it can be really helpful to communicate to your provider how you're feeling in a pregnancy after loss so they can do things to help you feel more confident in your pregnancy. I hope that this video was helpful for you, and know that you're not alone in this experience. I had 2 pregnancy losses in between my first and second child, and it really impacted how I was feeling in my pregnancy with my son. Just know that you're not alone if you've had a pregnancy loss. 1 out of 4 of us have had one. I've had 2 myself, and so I'm here with you as you navigate this journey.